The next speaker is Misheck Gondo from the regional coordinator for the SADC group. And before, I'll just give a quick introduction to Misheck. We were honored, delighted, really energized by our engagement with SADC youth, the 16 youth parliaments across 16 African countries. We were amazed at the level of engagement being shown by the youth in those countries, very organized and very willing and enthusiastic and ready to go. They really do represent a huge asset and a great, for me personally, a great inspiration in terms of what's possible within community engagement. Underlying that is a lot of, how to put this, operational, organizational skill sets. And I think that's really exemplified in terms of Misheck and our engagement with Misheck. And rightfully, he's the regional coordinator for such a complicated setup across those countries. It's my great honor and pleasure to introduce Misheck Gondo, the regional coordinator for SADC Youth. So hello to you, Misheck, joining us from Zimbabwe, and I'm going to hand over the floor to you.
Thank you very much. And as we meet today, and as noted in the past days, that different stakeholders they have a role to play in terms of NTDs. In particular, our discussion today, the dengue fever, and of course from the SADC Youth Forum, which is an arm within the SADC regional body, we are not only engaging on this fight from an implementation perspective, but we are taking it from a policy perspective, just taking from our SADC Youth Forum that is held annually alongside the heads of states and government meeting. There was a deliberation that passed in the declaration that young people have got a critical role to play with regard to the NTDs and the fight against malaria. And today, like what I've alluded to, there's many approaches definitely that we can take to make sure that the young people are involved. And coming from the 16 SADC countries that are part of Africa, and I agree with Kamran that some of the diseases are actually underreported. And there's a lot of work that needs to be done in terms of research. And young people can come within this gap in terms of researching. We are talking of young people that are in the medical fraternity. We are talking of young people that are in universities. I think they can come in to come with data, providing data on how these diseases are underreported. Dengue fever exists among the people and is in many countries, especially in poverty-stricken areas, with children and young people being part of the most affected, if we look at that. And statistically speaking, if you look at SADC, we constitute more than 60% of the total population. These are young people between the ages of 15 to 35 years, without including the children that are 14 and below. So in terms of numbers, and these young people are also the most people that are also living in this poverty. There is a huge information gap about the diseases in many communities and countries. And it is very dangerous, actually, let me say, for communities to live with diseases that they are not aware of. And so this will result to many deaths, many maybe young people getting to disabilities, among other issues, because they are not, the information about these diseases is not available. The answer, some of the answers to the information gaps, prevention and control can be provided by effective involvement of all stakeholders, and with young people playing a critical and a central role in the fight against these diseases. Strategies can be proffered by young people. Some of the strategies that I'm going to highlight in my few minutes that I have, the issue of advocacy, by raising awareness and education at community level. And what are we saying when we are talking of community level? Community is divided into different sectors. We've got community start from an individual perspective. We've got a family, we have the maybe the village. So what I was talking about is the aspect of mobilization, the aspect of advocacy, by raising awareness and the role that young people have at community level. And I was trying to just highlighting the aspect of how the community is arranged in terms of from the family level, from the individual level, the family level, the community level, then we go to provincial level, the national level, and the regional level. So if information is cascaded to the individual at community level about what is dengue, how does it affect young people, how does it affect families, that will be very important in the advocacy of making sure that everyone else is aware. The involvement of youth and communities in the fight, the control practices, the community participation itself. Another critical point is the mobilization of those local communities and active local leadership. You know, local leaders, they play a very important role in terms of information dissemination, also important in terms of buy-in of certain information. So the local leadership, if it is in some African countries, if we are talking of chiefs, we are talking of headmen, if we are talking of local business people, they need also to be acquainted, to be knowledgeable about some of these diseases such as dengue, and they play a critical role, but also with active participation of governments and non-governmental organizations, local-based organizations, community-based organizations for initiative for preventive strategies. You know, also community-based programs run by young people. You know, young people are so innovative. Young people, if they are given information, they can lead, involving local authorities as well, to participate in eliminating, for example, eliminating the breeding spaces for dengue mosquito. This will be cost effective because local authorities and people at community level are participating, and this is a sustainable way of ensuring that control of dengue is affected in countries. Then, in terms of at a policy level, there is also need to introspect to say how best can we come with effective policies at our countries. For example, in SADC, we have the health policies that are there in different countries. How effective can young people also lobby for their governments to make sure that the issue of neglected tropical diseases, the issue of dengue, is addressed at policy level? So the policy level, when the government commits itself to solve these issues, then you know that even in terms of budgets, when they are coming out with national budgets, resources are also allocated in addressing this. That's why it is important to be at policy level. Then also at regional level, for example, I'm talking of SADC, where I coordinate young people, the SADC level. When the heads of state, for example, when the department, the ministers for health are meeting, those are some of the issues that we are going to take through as the youth regional board, to say also how best they are going to discuss at policy level the support at this. Then at country level, I mentioned the involvement of health ministers, health institutions, the private sector. Also, we have the religious groups. The tertiary institutions also play a critical role, like universities and colleges, then individuals, as I've mentioned. Another critical factor, ladies and gentlemen, is the issue of training, capacity building. Are people acquainted? Do they have right knowledge to talk about the neglected tropical disease? Do they have a right knowledge about the dengue fever? So we need to make sure that as an advocate too, we also have some maybe short courses. We all have community interactions at schools, in colleges, and we have champions that now cascade that information at community level, that work with young health workers in these communities, and we promote evidence-based responses. Then we ignite the application of innovative and sustainable solutions, for example, in areas that dengue fever is affecting. Also, preventative measures are very important, because we should not wait for dengue to affect communities, but pre-sensitization, so that communities, they are aware if they have got some individuals have got some symptoms. When they visit the health institutions, they will be able actually to respond accordingly, because they have the right information. Some of the tools also that can be used, you know, young people are very good in terms of use of technologies. How best can we use technologies in the fight against dengue? How best can we use social media? How best can we use mainstream media to fight dengue? Also, how best can we use arts and culture? If, for example, community drama groups in the communities, how best can you use local musicians to sing about dengue fever? So there's a lot of things that you can do to promote the knowledge and the information about dengue. My colleague, Maximillian, will talk about some practical issues which we are doing at community level. But before I conclude, Kamran, I need to highlight these critical factor, the collection of information, like having data, but also we also have another tool that we have, like what I highlighted, the SADC Youth Parliament on policy issues that can also, you know, within where they represent different parliamentarians in their country, they can become advocates as well, but working with local young people in terms of key policy changes, but also engaging the ministers of health, engaging the health institutions in coming out with key strategies and best responses that we can do collectively. But also using the tools. Some of them I've highlighted. One of the tools is engagement, both at country and regional level, but also community mobilization, social media, mainstreaming, podcasts, short videos, news bulletins, for example. But what is also important is the use of local languages. We need to translate this information to be understandable at local level so that people, they understand in their local languages. If we are in Tanzania, if we are in Malawi, if we are in Zimbabwe, they'll be able to relate with the information that we are trying to bring. Some of the aspects that we can use is the issue of essays, journals, if it is colleges, articles, debates in schools, you know, universities. Also use of young celebrities and influencers to fight dengue. My last point on this note is the emphasizing on making sure that governments, they put resources in their budgets to fight dengue. Governments, they put budgets, you know, budget allocation to fight neglected tropical diseases. Then I have these key statements that I need to conclude with. Mobilization of community at the level of family, village, community, national, regional level is effective in prevention and control. Community mobilization, but however, it requires decentralization of resources and powers. There's need of high-level coordination among stakeholders to realize the fight against neglected tropical diseases, in particular dengue. Also, effective coordination among local communities, young people, the government, agencies, NGOs, local leadership is vital for effective implementation of dengue prevention. And lastly, young people play a very important role, not only as mobilizers, but as stakeholders, stockholders, leaders for transformation to fight dengue. Thank you very much for this opportunity, Kamran. Back to you.